The current state of emergency in our hospitals is a crisis that deeply concerns us all. Recent reports have shown that patients are suffering unimaginable indignities, with many receiving care in areas that are meant for storage, such as cupboards, car parks, and even corridors. This alarming situation is not just an inconvenience, it's a matter of life and death. As healthcare professionals voice their distress, we must listen and reflect on the reality of those experiencing this system firsthand. An alarming number of healthcare workers, including over 5,000 nursing staff, shared haunting accounts of their daily experiences in accident and emergency departments. They reported seeing patients left in dire circumstances while they awaited care, sometimes for hours on end. For instance, one nurse described how an elderly woman, nearing the end of her life, had to endure the chaos of a busy corridor, surrounded by patients in distressing situations. This lack of privacy and dignity is not just a failing of the system. It is a humanitarian crisis that requires immediate attention. In one particularly heart-wrenching case, a patient passed away alone in a waiting area, hidden beneath a coat. This tragic incident highlights the severe understaffing and overcapacity issues that are plaguing our health services. Nurses have expressed their fears about the inability to monitor patients effectively in such crowded conditions. The image of patients not being discovered for hours is a haunting reminder that the current crisis could happen to anyone's loved ones. The testimonies from nurses are not only upsetting, but also serve as a wake-up call for both healthcare leaders and policymakers. A report from the Royal College of Nursing has brought to light the prevalence of corridor care, where patients are left to suffer without adequate medical attention. The emotional toll on healthcare workers who witness these scenarios daily is immense. Many have recounted their heartache and disillusionment, leading some to make the difficult decision to leave their jobs entirely. In conclusion, it is clear that we are facing a critical turning point in our healthcare system. The stories shared by those on the front lines act as a clarion call for change. We must advocate for better resources, improved staffing, and a renewed commitment to patient care that prioritizes dignity and humanity. As a society, we cannot afford to ignore these alarming realities. Every patient deserves a fighting chance, and it is our responsibility to ensure that they receive the compassionate care they urgently need.